osteomyelitis. Okay, so what does osteomyelitis means? Osteomyelitis is infection of bone and bone marrow. Bone and bone marrow is called as osteomyelitis. Okay, so osteomyelitis can be of the following types. It can be acute osteomyelitis, it can be subacute osteomyelitis, or it can be chronic osteomyelitis, What is the most common spread of infection to the bone? Most common way of spread of infection to the bone is by hematogenous route. So by blood only, most of the time organism reaches the bone. Okay, hematogenous means via blood. So most of the time via blood only the organism reaches the bone. See, you have to know the basic arrangement of blood vessels in a bone. In the bone, there is an artery called as nutrient artery, which enters the bone and it divides into two. One goes towards the upper end and one goes towards the lower end. The artery, when it goes towards the metaphyseal region, we all know what is called as metaphyseal region. Yeah? So yesterday we saw the parts of the long bone: epiphysis, metaphysis, and diaphysis. So when the artery reaches the metaphyseal region, it forms arrangement like this. This kind of arrangement is called as hairpin arrangement. Okay. Now what happens when the blood passes through this blood vessels, and when it reaches the metaphyseal region, it passes through the hairpin loop. So the blood flow decreases. Blood flow becomes sluggish. So when the blood flow becomes sluggish, microorganisms has got easier chance to escape from the blood vessel into the bone. Can you able to understand this? Because the blood vessels are arranged in the form of a loop, blood cannot go rapidly through that. Blood goes very slowly through that loop. So when the blood is very sluggish, microorganism easily escapes out of that blood vessel into the bone. Okay, here the blood flow is fast, but when it comes to this area, the blood vessels are more porotic and also the blood flow is very sluggish. So the microorganism escapes. That is why in the metaphyseal region, osteomyelitis is common. In the metaphyseal region. So very, very important point. So osteomyelitis is common in the metaphyseal region, and especially the metaphyseal region of distal femur is the most common site for osteomyelitis. Okay. So osteomyelitis is common in the metaphyseal region. Which bone? Especially distal femur is the most common site for osteomyelitis. So these are very, very important points. These are frequently asked MCQs. After distal femur, proximal tibia is the most common site. After distal femur, proximal tibia is the second most common site for osteomyelitis. Okay. Fine. So now we are going into the next part of osteomyelitis, how the process happens, how the pathogenesis happens. See, let us consider this is a bone. Okay, let us consider this is a bone. Usually bones are covered by an outer layer called as periosteum. Okay, the outer covering of bone is called as periosteum. Okay, hope you know what is called as periosteum. Peri means outer. Okay, so periosteum means outer covering of bone. What is the function of periosteum? Periosteum has a role in bone formation. It increases the oppositional growth of the bone. Okay, see, a bone has to grow in two ways. A bone has to grow in length and a bone has to grow in width. Okay, the length of the bone is by the epiphyseal plate. Yesterday we saw the epiphyseal plate. So when the length of the bone increases, we grow in height. So what is the main cause for increase in vertical length of the bone is the epiphyseal plate. But how the bone thickens? The bone thickens by the periosteum. Periosteum forms new bones, so the bone thickens. So such a growth is called as oppositional growth. Such a growth is called as oppositional. So increase in thickness of the bone. Increase in thickness of the bone is called as oppositional growth. Okay, increase in thickness of the bone is called as oppositional growth. So this is periosteum. Now what happens when the microorganism, let us consider this is the blood vessel and the microorganism is passing through the blood vessel and it escapes out. And when it escapes out, it lodges in the metaphyseal region. Okay, it lodges in the once microorganism enters the metaphyseal region, osteomyelitis process has started. Osteomyelitis process has started. First change which will happen is marrow edema. First change which will happen is marrow edema. Slowly it becomes abscess. Slowly it becomes abscess. More than 24 hours. After 24 hours, abscess formation occurs. After 24 hours, abscess formation occurs. So when bone infection starts, the patient will present with pain and patient will present with fever. The patient will present with pain and the patient will present with fever. And if you diagnose osteomyelitis within this 24 hours, then you can treat with only antibiotics. Treat with only antibiotics. Very, very simple. Can you able to understand this? See, the organism enters the bone, infection starts, abscess formation process usually begins after 24 hours. So before 24 hours, within one day, if you diagnose that the patient has got osteomyelitis, then you can treat the condition only with antibiotics. Okay, but once abscess formation starts, after 24 hours, if abscess formation starts, the abscess has to be drained. If the abscess is not drained, the infection will not settle. Okay, it is the dictum in general surgery also, not only in orthopedics, in general surgery also. If an abscess is formed, you have to drain the abscess, because in abscess, the microorganism will stay happily. The antibiotics, whatever you are giving, will not act in the abscess. So in the abscess, antibiotics will not work. So you have to drain the abscess. So before abscess formation, you can treat with only antibiotics. Okay, now what happens to the organism which has settled here? Slowly, the organism forms abscess in this region. So the abscess increases in size, and slowly this abscess tracks through various canals in the bone, and there are certain canals called as Oakman's canal. I hope you know the anatomy of bone. There are certain canals in the bone which are called as aversion canals. These aversion canals are connected by canals like this. These are called as Oakman's canal. I hope you know this in anatomy. Oakman's canal and aversion canal. So through these canals, infection slowly spreads and it reaches the outer part of the cortex. So this is bone again. So infection tracks out and it breaks the cortex and it comes below the periosteum. And it comes below the periosteum. Okay, clear? And it comes below the periosteum. Now what happens is, once the infection reaches this area, it lifts off the periosteum. It lifts the periosteum. Okay, so the periosteum it gets lifted off because of the abscess. Now the abscess is collected here. Okay, clear? So the abscess is in this region also. Now what happens when the periosteum is lifted? Do you know the blood supply of a bone? How a bone gets its blood supply? Any idea about that? There are two blood supply for a bone. I am making a cross section of the bone. This is cross section of the bone. Okay, this is cross section of the bone. This is the medullary cavity of the bone. What is this cavity called as? Medullary cavity of the bone. Okay, so within the medullary cavity there is an artery called as nutrient artery, which supplies the inner 1/3 of the bone. It supplies the inner 1/3 of the bone. On the outside, you got the periosteum. From the periosteum, you got periosteal blood vessels, which supplies the outer 2/3 of the bone. So blood receives blood supply both from the periosteum and from the nutrient artery. So from the periosteum, blood vessels goes and supplies the outer part of the bone. From inside, nutrient artery supplies the inner aspect of the bone. Now just imagine an abscess is formed here and it has lifted off the periosteum. Now what happens to the blood supply to the bone? What happens to the blood supply to the bone? The blood supply gets cut off. Once blood supply gets cut off to an area, will the tissue be live or it will be dead? Dead. Okay, now this part of the bone where blood supply is cut off will become a dead bone. Will become a dead bone. This dead bone is called a sequestrum. Please remember this term, very, very important. This is called a sequestrum. This is called a sequestrum. Once sequestrum is started, then that stage is called as chronic osteomyelitis. Chronic osteomyelitis is hallmark of, sequestrum is hallmark of chronic osteomyelitis. Sequestrum is hallmark of chronic osteomyelitis. Okay, fine. See, whenever the sequestrum is formed here, then it becomes chronic osteomyelitis. Now what happens to the periosteum on the outer side? The periosteum always has a nature to fight. Okay, periosteum has got a nature to fight. Now it fights the infection by forming new bone. So periosteum will start laying new bone. So periosteum will start laying new bone here. The new bone which is formed on the outer side of the dead bone is called as involucrum. What is this called as? This is called as involucrum. So the sequestrum is dead bone, whereas involucrum is new bone. Whereas involucrum is new bone. Okay? If the infection is not treated at this time also, if it is not properly treated, the abscess which is there will pass through the involucrum and it will come out again. So there are canals which are created in the involucrum is called as cloaca. The canals which are created in the involucrum is called as cloaca. So in the involucrum, canals will be created. First will come out of the involucrum. So those canals are called as cloaca. So three terms are very important here. One is sequestrum. One is sequestrum. Sequestrum means dead bone. In X-ray, it will be uniformly sclerotic. It will be uniformly sclerotic. Very important. It will be like white, complete white bone. So which is called as sequestrum, this dead bone. The next hallmark is involucrum. Involucrum is new bone which is formed around the dead bone. So this is new bone. And what is cloaca? Cloaca are canals created in the involucrum through which abscess comes out, through which abscess drains out, through which abscess drains out. Okay, so these three features, if it is seen, then the condition is called as chronic osteomyelitis. Then that condition is called as chronic osteomyelitis. So just remember this, very simple. Acute osteomyelitis can go in two ways. If you treat it properly with the antibiotics, it can resolve without sequelae. It can resolve without any effect. It can resolve without sequelae. If it is not treated properly, it can go into chronic osteomyelitis. It can go into chronic osteomyelitis. Okay. Now, once a patient has got osteomyelitis, how are you going to diagnose osteomyelitis? The first thing to diagnose osteomyelitis is based on blood investigations. So in blood investigations, you do complete blood count. In complete blood count, you can see the WBC count being elevated and neutrophil count being elevated. So once you diagnose osteomyelitis, you do blood investigation first. In that you can see WBCA being elevated and neutrophil count being elevated. There is an inflammatory marker called a C-reactive protein, CRP. Usually C-reactive protein will be elevated within 6 hours of infection. Within 6 hours of onset of infection, C-reactive protein will be elevated. Next is you can do blood culture. How the organism spreads to the bone? How the organism commonly spreads to the bone? Hematogenous, through the blood. So you take the blood and culture it. So you can identify the organism by doing blood culture. Identify the organism by doing blood culture and give appropriate antibiotics. These are the blood investigations which can be done. What are the radiological investigations that can be done? Radiological investigation. So you do X-ray. The earliest sign to be seen in an X-ray is loss of soft tissue planes. Usually periosteal reaction will be seen in an X-ray by 7 to 10 days time. By 7 to 10 days time only you will see the periosteal reaction. Before that you will not see the periosteal reaction in an X-ray. So the earliest sign will be loss of soft tissue plane that can be seen in an X-ray. Okay. The second investigation which can be done and which is the investigation of choice in osteomyelitis is MRI. MRI is the investigation of choice in osteomyelitis because it can pick osteomyelitis within 6 hours of onset. Within 6 hours of onset, marrow edema occurs. This marrow edema can be easily picked up by MRI. You can also do bone scan. Using technetium 99M, or you can use indium label 1111 to diagnose the osteomyelitis. So these are various modalities to diagnose osteomyelitis radiologically. What is the role of CT scan? CT scan has a role to identify the extent of involucrum and the sequestrum accurately. So this CT will help in identifying the extent of involucrum and the sequestrum. It is more helpful in identifying the extent of involucrum and sequestrum. Okay. So CT will be more helpful in chronic osteomyelitis. MRI will be more helpful in acute osteomyelitis. So MRI will pick up osteomyelitis within 6 hours of onset. The marrow edema in the bone will be picked by MRI within 6 hours. If you diagnose osteomyelitis within 24 hours, you can treat it without surgery with antibiotic alone. Okay. So you treat the patient for fever. The patient will present to you with the fever. So you treat the fever with antipyretics. Can anyone tell me one antipyretics you know? One simple antipyretic? Paracetamol. Okay, very good. So fever can be treated with antipyretics. Infection can be treated with antibiotic. The limb can be rested. Limb has to be rested because movement will cause pain. So you can give rest to the limb. You can give ice packs to reduce the inflammation. So these are the various treatment modalities in acute osteomyelitis. These are the treatment modalities we follow. Okay, if abscess is formed in acute osteomyelitis, then it requires drainage. Okay. Then it requires drainage. Now, if the osteomyelitis has become chronic osteomyelitis, what does it require? It requires debridement. And what you do with the debridement? You remove the dead bone. Removal of dead bone, because once the dead bone is inside, it won't allow the infection to settle down. So you remove the dead bone. Removal of dead bone is called a sequestrectomy. Then you take deep cultures. Identify the organism. Give appropriate antibiotics. give appropriate antibiotics. You have to give antibiotics through IV at least for 2 weeks and plus oral antibiotics for 4 weeks. So total antibiotic duration should be at least 6 weeks. So total antibiotic duration should be at least 6 weeks. Very, very important point. So total antibiotic duration should be at least for 6 weeks in chronic osteomyelitis. Okay, clear? So how you treat chronic osteomyelitis? It requires surgery. There is no go for it. You have to remove the bone and removal of the dead bone. The dead bone is called a sequestrum. So you remove the sequestrum outside, that is called a sequestrectomy. And then you have to take deep cultures. Okay, so these are the important management ways for chronic osteomyelitis. Now there is one condition called as subacute osteomyelitis. There is one condition called as subacute osteomyelitis. Now what is called as subacute osteomyelitis? Subacute osteomyelitis is where the patient or the host immune condition is very good. His immune condition is strong. So he can easily fight against the infection. So the infection cannot spread. So there will be localized infection in the bone. In X-ray, if you see, let us consider this is a bone. In X-ray, if you see, there will be a sclerotic area. There will be a sclerotic area surrounding a lytic area. Surrounding a lytic area. So this is the source of site of infection. The site of infection is controlled by the host himself because his immune is very good. He forms a good bone around this area. So this is called a subacute. Subacute osteomyelitis, if one question has to come from subacute osteomyelitis, that is how the patient immune condition will be. It will be very good. It will be strong. What is the most common organism causing subacute osteomyelitis? Staphylococcus aureus. Remember this word Staphylococcus aureus in your life if you are talking about bone. Okay, so most common organism causing any osteomyelitis, whether it is acute or whether it is subacute or whether it is chronic, the organism will be Staphylococcus aureus. The organism will be Staphylococcus aureus. Okay, very, very important. Most common organism causing osteomyelitis is Staphylococcus aureus. But there are certain exceptions. Most common organism causing osteomyelitis in a sickle cell disease patient. You know what is called a sickle cell disease? Okay, there is a condition called a sickle cell disease. Okay, where the hemoglobin goes in the form of a sickle. Okay, so that sickle cell disease, in a patient has got sickle cell disease, Salmonella typhi. Salmonella typhi is the organism which causes osteomyelitis if a patient has got sickle cell disease. Most common organism causing osteomyelitis in IV drug abuses. IV drug abuses is Pseudomonas. Most common organism causing infection in diabetic foot. It will be polymicrobial. There will be multiple organisms. There is not single organism. There will be multiple organisms. It will be polymicrobial in nature. Okay. So these are important points in osteomyelitis. And the take-home message from this is the earliest sign in X-ray is loss of soft tissue plane, and MRI will pick up osteomyelitis at the earliest within 6 hours. Okay. Fine. So with this we are done with osteomyelitis.